What causes anemia? Anemia is a condition in which you lack enough healthy red blood cells to carry enough oxygen to your body's tissues. Anemia, also referred to as low hemoglobin, can make someone feel tired and weak. Symptoms: weakness, fatigue, pale or yellowish skin, irregular heartbeats, shortness of breath, dizziness, chest pains, cold feet and hands, headaches. Causes: anemia may be caused by a condition known as congenital that is present at birth, or by a condition that you develop. Anemia occurs when your blood doesn't have enough red blood cells. This happens when your blood doesn't make enough red blood cells. Your body destroys red blood cells. Bleeding causes you to lose red blood cells more quickly than can be replaced. Red blood cells. There are 3 types of blood cells that are made by your body. White blood cells fight infection. Platelets help your blood clot. Red blood cells carry oxygen from your lungs to all parts of your body and carbon dioxide from other parts back to the lungs. Red blood cells contain hemoglobin. Hemoglobin is an iron-rich protein that gives blood its red color. Hemoglobin enables red blood cells to carry oxygen from your lungs to all parts of the body and carry carbon dioxide from other parts of the body to your lungs to be exhaled. Your bone marrow produces most of the blood cells, including the red blood cells. To produce hemoglobin and red blood cells, your body needs iron, vitamin B12, folate and other nutrients from the foods you eat. Different types of anemia have different causes. They include iron deficiency anemia. It's the most common type of anemia. It's caused by a shortage of iron in your body. Your bone marrow needs iron to make hemoglobin. Without adequate iron, your body can't produce enough hemoglobin for red blood cells. This type of anemia occurs in many pregnant women. It's also caused by blood loss, such as from heavy menstrual bleeding, an ulcer in the stomach or small bowel, cancer of the large bowel, and regular use of some pain relievers, especially aspirin. Vitamin deficiency anemia. Your body also needs folate and vitamin B12 besides iron to produce enough healthy red blood cells. A diet that lacks this and other key nutrients can cause decreased red blood cells production. There are also people who consume enough B12 but aren't able to absorb the vitamin. This can lead to vitamin deficiency anemia, also known as pernicious anemia. Anemia of inflammation. Diseases like HIV/AIDS, rheumatoid arthritis, kidney disease, Crohn's disease and other acute or chronic inflammatory diseases can interfere with the production of red blood cells. Aplastic anemia. It is rare and life-threatening. This type of anemia occurs when your body doesn't produce enough red blood cells. This is caused by infections, some types of medicines, autoimmune diseases and exposure to toxic chemicals. Anemia associated with bone marrow diseases. Diseases like leukemia and myelofibrosis can cause anemia by affecting blood production in your bone marrow. The effects of these types of cancer and cancer-like disorders vary from mild to life-threatening. Hemolytic anemia. This groups develop when red blood cells are destroyed faster than bone marrow can replace them. There are certain blood diseases that increase red cell destruction. Sickle cell anemia. This is caused by a defective form of hemoglobin that forces red blood cells to assume an abnormal crescent or sickle shape. These irregular blood cells die prematurely, resulting in a chronic shortage of red blood cells. Risk factors. The following factors increases your risk of anemia. Intestinal disorders. An intestinal disorder affects the absorption of nutrients in your small intestine. A diet lacking in certain vitamins and minerals. A diet that is consistently low in iron, vitamin B12, folate and copper increases your risk of anemia. Menstruation. This causes loss of red blood cells. Pregnancy. If pregnant and not taking a multivitamin with folic acid and iron increases to a risk of anemia. Chronic conditions. Diseases like cancer and kidney failure put you into a higher risk of anemia. These conditions can lead to a shortage of red blood cells. Family history. If your family has a history of an inherited anemia like sickle cell anemia, you might also be at increased risk of the condition. Age. People over 65 years of age are at increased risk of anemia. Complications. If not treated, anemia can cause many health problems such as extreme fatigue. When anemia is severe, you get so tired that you can't complete everyday tasks. Pregnancy complications. Pregnant women with folate deficiency anemia can be more likely to have complications like premature birth. Heart problems. When you are anemic, your heart pumps more blood to make up for the lack of oxygen in the blood. This can lead to an enlarged heart or heart failure. Death. Some inherited anemias like sickle cell anemia can lead to life-threatening complications. Losing a lot of blood quickly results in acute, severe anemia and can be fatal. Prevention. Many types of anemia can't be prevented. However, you can avoid iron deficiency anemia and vitamin deficiency anemia by eating a diet that includes a lot of vitamins and minerals. This include iron-rich foods. This include beef and other type of meat, beans, iron-fortified cereals, dark green leafy vegetables and dried fruit. Folate. This is found in fruits and fruit juices, dark green leafy vegetables, green peas, kidney beans, peanuts and enriched grain products like bread, cereal and rice. Vitamin B12. Foods rich in vitamin B12 includes meat, dairy products and fortified cereal. Vitamin C. Foods rich in vitamin C include citrus fruits and juices, peppers, broccoli, tomatoes, melons and strawberries. Diagnosis. The doctor will ask questions about your medical and family history, perform examination and run the following tests. Complete blood count. This is used to count the number of blood cells in a sample of your blood. For anemia, your doctor will test the levels of the blood cells and hemoglobin in your blood. A test to determine the size and shape of your red blood cells. Some of your red blood cells might also be examined for unusual size, shape and color. The doctor might also study a sample of your bone marrow. Treatment. Iron deficiency anemia. Treatment involves taking iron supplements and changing your diet. It may also involve receiving iron through injecting through the vein. If the cause of iron deficiency is loss of blood other than from menstruation, the source of the bleeding must be located and the bleeding stopped. This might involve surgery. Vitamin deficiency anemia. This involves increasing intake of food with folic acid and vitamin C or supplements. If your digestive system has trouble absorbing vitamin B12 from the food you eat, you may need vitamin B12 shots. Anemia of chronic disease. Doctors focus on treating the underlying disease. If symptoms become severe, a blood transfusion or injections of a synthetic hormone that is normally produced by your kidneys might help stimulate red blood cell production and ease fatigue. Aplastic anemia. This includes blood transfusions to boost levels of red blood cells. You might need a bone marrow transplant if your bone marrow can't make healthy blood cells. Sickle cell anemia. This might include oxygen, pain relievers, oral and intravenous fluids to reduce pain and prevent complications. Doctors may also recommend blood transfusions, folic acid supplements and antibiotics.